Lower back pain is a very serious complication. Young adults as young as 20s and 30s are experiencing lower back pain these days. But due to myths and several false information which are going around this disease, many of the cases do not reach medical treatment. Today at Times of India, we have with us Dr. Aditya Bhati, consultant neurosurgeon and spine surgeon, Indraprastha Apollo Hospitals, New Delhi, who will help us understand what are the causes of lower back pain, what are the signs of lower back pain, and why one should take medical help as early as possible. Welcome, Dr. Bhati, to Times of India. Thank you for giving your valuable time to us. Sir, please help us understand what is lower back pain and why is it occurring in so many young adults today? What are the causes? And also please help us understand the signs of lower back pain and why one should go to doctors as early as possible.
We all know that, as you clearly said, that lower back pain is one of the most common ailment which is we all see in our day-to-day life. Every other person complains of lower backache, and most commonly this is in young and even more common in elderly. Right. When you talk specially about young adults are more prone to this in these scenarios. I mean, in couple of years, we have seen that the young adults are more prone towards low backache. There are special reasons for that. You all know that for last couple of years, the COVID has taken a toll on us. And first and foremost thing is the sedentary lifestyle. Young adults have actually stopped the physical activity. They are not going out. They are staying at home, and they are actually, the physical activity has drastically come down. Part one. When you are moving around, the muscles are acting and the muscles get stronger and stronger. When you stay at one place under a roof, the vitamin D activity, inside our body is less. So that is also, one of the key element of bone, bone formation basically. So most common is decreased physical activity, staying at home. These are the common reasons. Apart from that, why young adults? Young adults are in other way when you take it, when they go out, they are more prone for injuries. Adolescent age group. And they are active also. Then they are more prone for back injuries. And they try to ignore these because they think that staying, taking rest can, help out, or taking over-counter drugs.
Young, they can heal easily.
Yes. And moreover, they heal. And few of the young adults and few of the patients, the injury is serious enough to, they to an extent that they have to meet a doctor of somewhere. But one is sedentary lifestyle, two is the increased physical activity. The other thing are basic muscle spasm. More importantly, when you see in heavy lifters, they lift the heavy objects without proper directions. They go for gymming and everything. They are not actually taught the way they have to lift the objects or the heavy machinery or whatever. Right, gym rules. Yes, they actually don't follow those. So you have to tighten your back or wear a proper belt so that you can lift it up. These are actually the main causes in young adults. Other than that, these are common things. What are uncommon are disc problems, spine tumors, spine infections, and one of the most important thing is, vascular malformation. Any blood vessel malformation inside the spine. These are little rare.
Thank you, Dr. Bhati, for all the valuable information. Now we have some very common questions around lower back pain, which very often people ask. And one of those questions is, how can one reduce the risk of lower back pain?
See, the risk of lower back pain can only be realized when you start doing the things which I have said. They have to be active in a while. They should start physical activity, going out and not staying, in a shade. so that they can get enough of sunlight outside. When they go out, when they play, the muscles gets taut and they are less prone for injuries in a way. Okay. And using specific belts when they are lifting heavy objects. These are the things which are not preventable, are like tumors, infections, or vascular malformations.
My next question would be, like you said, there are several signs of lower back pains, but what are the red flags that should be noticed and that should actually compel somebody that no, right now you have to see a doctor. You cannot ignore this thing right now.
See, whenever I'll talk about red flag little later, but the more importantly, whenever a young adult has backache, the first and foremost thing one has to do is he has to take rest. Part one. And obviously, when they take rest, if the pain is severe enough, they take over-counter drugs. Okay, the paracetamol kind of thing they take so that the pain can be relieved, or the muscles muscle relaxants, that pain would go in a couple of days. Rest, muscle relaxant, hot pack application, or a LS belt, so that they feel comfortable with. These are the things, these are initial management. The things which are important, red flag signs are important when these symptoms, when I'll be talking about those symptoms, when they have these, they have to visit a doctor. Back pain not relieved with these maneuvers, analgesics, anti-muscle relaxants, bed rest, and along with hot pack. When they don't get relieved with this, when the pain is severe enough that it is not controlled by all these, he has to visit a doctor. That is the foremost. Second important thing is when the backache radiates to the leg, severe enough that he is unable to walk. The third important thing is when the back pain is associated with weakness of the legs or numbness of the legs. The other most important thing is when there is bowel and bladder incontinence. That means he has difficulty in passing urine or he has constipation. Right? These are important things. These are red flag signs. And that means he has to meet a doctor.
So overall, we understood that lower back pain, when it affects the quality of life, then you should not hesitate. You should not delay further and visit a doctor and get it treated. Another important question that rises here is, there are several non-medical treatments that have been followed in several families and all, that if you sleep on the floor, you will be relieved of lower back pain, or if you consume any Ayurvedic thing, or if you do certain things, your lower back pain will ease. So what are your views on this? Should one rely on these treatment methods? And if yes, then won't it make the situation more aggressive? So what should be, or what is the point where one should stop actually doing all these non-medical treatments, and they should go to a doctor?
When you talk about rest and the bed rest, along with whether to sleep on the floor or on a particular mattress, that is the main question you must have. I suggest sleep on such a mattress which is not that spongy, so that when you sleep on it, you don't go according to you weight. You bouncy mattress you should not, because that will not heal your back. You should not also sleep on such a surface, hard surface, that your back becomes stiff. It should be in between. Okay, the body has to be relaxed. Not that it is actually when you sleep on a hard surface, obviously your pain will increase. When you talk about the second part, Ayurvedic part, see, as an allopathic doctor, I'm not more into Ayurvedic treatment. See, as of, I don't think they have any side effects. So if they want to take, I don't have any, problem with that, or, I don't have any recommendations or something like that.
Sir, my next question would be around females. So in females, the lower back pain is very commonly seen after a certain age. They're very commonly seen. And since a woman's body goes through a lot, from pregnancy to menopause and everything. So, what special recommendation you would have? What suggestion you would have for females who are dealing with lower back pain?
That's a very good question, actually. So basically, when you talk about back pain in women, see, starting from pregnancy, when there is pregnancy, there are certain hormones are released, which actually releases or relaxes the muscles of the pelvic floor as well as the whole body, actually, so that they are prepared for the childbirth. Along with that, the ligaments also get relaxed, pelvic ligaments. So when there is childbirth, the bones as well as when the ligaments get relaxed, the bone also, they extend. I mean, they get relaxed so that the childbirth can occur properly, right? So many patients after childbirth, I'll talk about the pre also. After the childbirth, they complained of low backache because it has stretched to an extent that all the muscle gets strained. Okay. And after the delivery, the original, the hormonal level will come down. So when the hormonal levels in the body during pregnancy are high, they stretches the muscles and the ligaments. After that, there is no stretching as such. So they get sore and they have low backache. They are usually they are treated with some analgesic anti-inflammatory medications along with rest and hot packs. Right, part one. During pregnancy, before pregnancy, they would have, because the shape of the spine changes because of the lordosis. The shape changes because they are carrying, so the back would be little lordos. That is, the shape changes. The normal shape changes because and the pressure is on the spine, so the low backache is more common in pregnant ladies. Part one. And in common in ladies, when they have into their menstrual cycle, at that time also they have these cramps and everything. Along with that abdominal pain, they have low backache. That is temporary thing that would be managed with antispasmodic along with the hormonal changes, basically, along with the hot pack and everything. And these are during this and during menopause. Let's talk about menopause now. Yes, during menopause, the important hormones, they come down, and there is loss of bone during menopause. Yes, that decreases because of the bone density is lost, and they are more prone for fractures also. The bone density is lost, they get weak, and because of that they have pain.
So my last question would be that if somebody is having lower back pain, or if somebody is noticing the red flags like you have mentioned, so what would you recommend them on how to manage the pain, or how to ease, or how to get relief from the pain? What would you recommend them?
As I told you, the red flags, whenever the patient or anyone has these red flags, he has to visit a doctor. The first and foremost thing he would do is he will take the detailed history along with that specific investigation according to the red flag sign. Mostly are x-rays, MRI, rarely CT, and rarely there is nerve conduction studies or EMG studies. These are specific tests for low backache, and along with that, when the patient has red flag sign, it will depend upon the red flag signs. Right now, when you talk about management involves what has come in the result, depending on the investigation, depending upon the problem he has. If the patient has only spasm, he might give you some special anti-spasmodic muscle relaxants, along with that rest and everything, LS blood. But when he has disc problem, sciatica, when he has sciatica, he might advise a surgery depending on but I will tell you one thing: 95% of the sciatica patients are managed conservatively with rest and medications. Only 5%, yes, only 5% patients require surgery. That is most important thing. People think whenever patient has sciatica, they require surgery. It's not like that. Only rarely require surgery. Most of the sciatica patients are managed conservatively. When you talk about other causes, when the tumor is there, tumor you have to take it out surgically. Other than that, infections are treated with medications, mostly TB, rarely bacterial. Along with that, they might require surgery. And trauma is one of the other cause. When the patient has injured the bone, or there is fracture of the vertebrae or the parts, then they require operation just to stabilize it. That's all it is.
So far we have understood all the every important information that we need for understanding lower back pain causes and the signs. So, Dr. Bhati, you have more than 17 years of experience in spine and neurology field. Would you like to share with us any of your cases that you find it is relevant to share with people?
There are few cases which actually, they make you feel proud, and they make you, when you see your patients smiling, when they come walking to you, huh, then they have recovered fully and they are working now, and you feel really proud and you feel more motivated towards patients, and you're towards your work. So one of my patients way back 6-7 years back, he presented with he had a fall from a tree, and he's from Jhansi. He came to my place, and his elder brother came to me. He said, he was talking to me. He told me, डॉक्टर साहब ऐसा ऐसा हुआ है और पैर नहीं चलते, आप इसको ठीक कर सकते हो तो हमें बताइए, एंड गारंटी कितनी गारंटी. I said, we deal with the patients, so we'll not talk about guarantee and everything. Just show me the scans. I asked him whether he is able to move his legs or not. I've gone through the history and everything. He wasn't able to move his legs. It was a history of fall 1 week back, and he had little sensations in his legs. So no bowel bottle control. He was on catheter.
And he was a young person?
He was hardly maybe 28-year-old. I told him that I make him understand that, see, spine injury is a very critical injury. You are already late. It's been over one week now. So I can see he required surgery. I saw his MRI and told him that he required surgery, but I'll do my best. I'll free the whole nerve, I'll fix it and everything. But rest of the things I don't know. He required physiotherapy and everything. I'll do my best. I did that. I removed the compression part and everything along with the fixation, screws and everything I did. And we started on aggressive physiotherapy. Okay. And he went to his place, and I was coordinating him with regular basis. 3 months later, he came with calipers. He was walking with calipers. Then he came after 6 months. He was walking with support. Can you imagine? He's driving a cab now. He's driving a cab, and his whole family, every year they come to meet me. At that time, his kids were young, and now they have grown up. But the whole family is happy. That's how these things make us, happier. Another patient who has a spinal tumor in the neck, basically, in the center of the spinal cord, he had so he's from central India. He came all the way. He said, sir, I only have this weakness. Apart from that, I don't have anything. Only weakness. I told him, you have a spine tumor it is in the center of the spine. When you see it, it's like a ball inside it.
This is a case of underdiagnosis. He was underdiagnosed.
Yes. So he presented, I told him, see, going and getting into the spine is very, a risky job. You might actually land up on a ventilator, a high cervical thing. Or along with that, you can have weakness of all your limbs and even your bowel and bladder. Then he said, sir, 2 months later, I have to, my sister is getting married, so please help me. It's all in your hands. Then I told him, you go home, tell them that he came along with his brother or some colleague. He came. I told him, you required surgery, and you come back after telling all these things at your place. That Dr. Sahab has said all these things. He went back. He came to me after 2 weeks. 2 months later, he has sister ki, wedding. Came, then I did some important tests along with MRI, other tests also. There's another specialized test that was tractography was done on his spine. That is specialized MRI test just to see where exactly are the fibers going. So we did, those tests are rarely done actually in the spine. Brain में तो करते हैं. So we did that. Then we saw that all the motor fibers are coming to one side. So we planned to get into the spinal cord through that window, and we operated on him. And we took the whole thing out. And post-operatively, he had little weakness. Now he's absolutely all right. He's moving around, and maybe down 4 or 5 months back, he brought me a portfolio of mine, and it was like that.
So thank you so much, sir, for sharing lots and lots of valuable information. And for those who look around, or those who are believing the myths and the false information around lower back pain, this is the right video for you. This is the right information that is being shared with you. Thank you so much.